Hi, my name is Shannon Miano, and I'm going to be discussing the effect of mental health on irritable bowel syndrome. The objectives of this presentation are to search for the best evidence related to IBS and mental health, determine the best practices, identify the practice gap in nursing, and make recommendations. So, anxiety and IBS. 1 in 5 adults suffer from irritable bowel symptoms, and those symptoms can be constipation, they can be diarrhea, they can be both. And before, people thought IBS caused anxiety, and now there's this idea that maybe anxiety is what causes IBS. So the idea of this project is to look at the evidence of whether or not the IBS symptoms are better when the anxiety is treated or when mental health is treated into these patients. 50 to 70% of patients that are treated for IBS are also diagnosed with depression and anxiety. And only 40% of these people get medical help. They don't know if that's because of the embarrassment or the cost or that sort of thing, but a lot of people that have it aren't officially diagnosed or treated for it. The importance of anxiety treatment to relieve IBS. This is important because unmanaged symptoms can lead to weight loss, the inability to enjoy activities. It can be costly for doctor's visits, medications. A lot of times it develops into malnutrition. These patients can have low self-esteem, they can be dehydrated, they don't want to eat, so they'll have lack of nutrients. And it can also lead to increased anxiety and discomfort. Anxiety and IBS treatment. So nursing interventions for these type of patients could be educating them about laughter yoga because that has been proven to alleviate IBS symptoms, encouraging exercise and mental health evaluation to see if the exercise can reduce the anxiety and to see if they might need medications to manage their mental health. Additional interventions include participating in therapeutic communication with these patients about their IBS, their anxiety, and encouraging them to have a diet high in soluble fiber that can promote healthy digestion, and it also treats diarrhea as well as constipation. The PICO question asked here is in patients that suffer from symptoms related to irritable bowel syndrome, how does addressing anxiety problems compared to bypassing mental health concerns contribute to the reduction of flare-ups throughout a 1-year period? Electronic databases used to look at this evidence include the CINAHL database and the Food Science Journal. Keywords that were used to search for the evidence are irritable bowel syndrome and anxiety. Limiters included articles that were published in the past 5 years, peer-reviewed, and English language. So in the first article, it discusses the comparison of laughter yoga and anti-anxiety medication on the anxiety and GI symptoms of patients with irritable bowel syndrome. The evidence obtained in this was from a well-designed RCT. IBS symptoms severity score in the medication group dropped by 0.13 units, and the scores in the laughter group dropped by even more, which is 0.35 units. Laughter yoga made the larger difference on the IBS symptoms in this specific study. The second one was the structure of resilience in irritable bowel syndrome and its improvement through hypnotherapy. So this one was a cross-sectional and perspective longitudinal data. It discussed hypnotherapy, desensitization, and this kind of involves you can sit somewhere and not always have to rush to the bathroom, and it kind of just desensitizes you to this social anxiety that you can't go anywhere, you can't do anything without having to rush to the bathroom. And IBS is based more on symptoms, so it's more subjective. It's harder to measure because it's about the patient's perception of are their symptoms better or are they not. And in this study, hypnotherapy did reduce the symptoms. Now, nursing anxiety treatment and IBS relief. Best evidence for nursing practice. That includes therapeutic communication, promoting a high fiber diet, educating patients about yoga and stress relief, encouraging exercise, and encouraging mental health evaluation. Implications for nursing practice, that for patients, it saves money, it allows them more freedom, it reduces their stress level, and that in turn increases their comfort. Benefits for nurses are that there's no adverse effects for treating the mental health for IBS. It increases patient satisfaction, and it's an easy implementation. None of these interventions are difficult. It's just being aware of them so that we can incorporate those into our care. Now, the practice gap. Why aren't we treating anxiety to reduce IBS symptoms? It's mainly the lack of knowledge. You don't know what exactly to do other than to give them pills to help them treat their symptoms, but if you're not aware that helping alleviate their anxiety will also reduce IBS symptoms, then you can't really educate your patient to do so if you're not aware. Also, lack of resources. Obviously, you can't do yoga sessions in the hospital, so that's not easy as far as the proof of what helps and what doesn't. Access to the mental health providers, that's also hard in acute care because if they're not in an acute mental health crisis, they aren't usually seeing mental health providers. And hypnotherapy is not currently something that we do regularly. That is something that you can promote a patient do outpatient or even reviewing some tips on their phone. But other than that, that's not something that you have right away access to. Guideline recommendations. So the guidelines, according to the American Gastrointestinal Society, tell you to increase soluble fiber in your diet, promote exercise and yoga for these patients, treat symptoms of all subtypes, including diarrhea and constipation, and then comparing these to your current protocols to see how you can implement these things into your daily care. Reflection. So, what are your feelings about discussing these sensitive subjects with your patients? Do you feel like it will be difficult? Do you think that it will be worthwhile? And what kind of response do you think that you're going to get? How do you think that you will be able to incorporate these recommendations into your care for these types of patients? And what barriers do you think that you will face with implementing this evidence-based practice? So what will make it difficult? What obstacles do you have to overcome so that we can proactively make this easier for the nurses as well as the patients? These are my references here. Thank you.